Okay, welcome everyone to our info session on the PhD program in Health Economics and Outcomes Research at the Choice Institute. We have some slides prepared that we will go through, and we have plenty of time for question and answer, both via the chat and at the end if people want to come off of mute and ask questions. So we'll go ahead and get started with some introductions. Do you want to advance the slide? So, well, you can go back real quick, actually. So what we're going to do is we'll do some introductions. We'll talk about the Institute itself, the structure of the program, get into the details of the application process itself, and then we'll reserve some time at the end again for question and answer. Okay, one more slide. So here is who we have on the call from the Choice side of things today. I'm Josh Carlson. I'm a professor and the graduate program director at Choice. I've been on faculty for about 14, 15 years. I got my PhD in this institution. Most of my work is in the area of economic analysis. I have a couple of clinical trials, economic analyses alongside clinical trials in multiple sclerosis as well. I teach both in the PharmD program, but also in the graduate program. I do an advanced modeling course in the winter of what would typically be the first year for PhD students. I am actually going to turn it over to my colleagues for the remainder because I actually have to go teach right now, but I did want to join today and welcome everyone and just encourage you to apply, and thank you for being interested in our program. So with that, I'll go ahead and sign off, and I'll turn it over to Anirban and the rest of the team.
Thanks, Josh. I'm Anirban Basu, Professor of Health Economics and the Director of the Choice Institute. And I also teach in the PhD program, the core course in causal inference and econometrics, but also guest lecture in several other courses. And I'm going to walk you through the program and our Choice Institute, and happy to answer questions you may have. But before I do that, let me turn to my colleagues for their introduction. Marina?
Hi, everyone. I'm Marina Gano. I am the Graduate Program and Operations Manager for the Choice Institute. So I'm the primary staff contact for prospective students and current students. So it's great to have you all here, and we look forward to answering your questions. Jing?
Hi, my name is Jing Li. I'm an Associate Professor of Health Economics at the Choice Institute. So I've been with Choice for 2 years. I got my training in PhD in Health Economics at UC Berkeley, and then I was a faculty at Weill Cornell Medical School of Cornell University for 6 years. And my research interests are in sort of using observational data for policy evaluation using causal inference methods and quasi-experimental methods. I also do some experimental economics, and area of interest are including aging and physician behavior. And very nice to meet you virtually. And I'll turn it to Juliet.
Hey everyone, my name is Julia Fox. I'm a third-year PhD student here at Choice. My research interest areas include aging and dementia. I've done some amazing work with Jing, as well as modeling and substance use disorder. So I'm here to answer any student perspective questions you might have. So don't feel shy at all. Feel free to ask questions in the chat. And of course, we're going to have our live questions answered at the end.
Thank you all. So Marina, maybe we can proceed. Yeah. So many of you may know, because obviously you're interested in the program, that we are the Choice Institute. We're a global leader in generating knowledge to improve the individual and the population health, both in the US and across the globe, through research, learning, and dissemination of that learning to impact various policies and decision making. Next slide. We have 3 missions: research, training, and service. And you know, it's been a few years ago we transitioned ourselves from a pharmacy specific program to a broader health economics program, given the breadth and depth of the work that we are doing. And as you can see through, as I go through the program, you will see all the facets of health economics that we bring out in our program. Next slide. Here's our core faculty. Some of these names you may recognize. They are leaders in their field in decision sciences, health economics, and outcomes research. We wanted to show the distribution of the different gradation of faculty in our program. We were very uniformly distributed, kind of junior faculty, mid-tier faculty, and senior faculty. And even our emeritus professors, Bill Devine and Lou Garrisons, are actively engaged in many aspects of our program. Next slide. Obviously, our critical infrastructure of our institute and our program are run by our staff. We have Liana De La Torre, who are online certificate manager. Many of you will get a chance if you come here as a PhD student to do a teaching assistantship in our online certificate programs. Obviously, you met Marina Gano, who is our main operations manager and the graduate program manager. And we have a staff scientist, Brig Guzauskas and Linda Liu, who help work with faculty, students, and staff on various research projects. Next slide. Besides our core faculty, we do have a very diverse number of adjunct faculty. These are faculty who are appointed at the University of Washington, but in a different department, and a whole host of affiliate faculty who are professionals outside the University of Washington. Now, these faculty are not just for the namesake adjunct and affiliate. They can only retain the name because they're actively engaged in our program, working with our students, lecturing, or participating in research projects. As you can see from some of the names, many of our students actually end up doing RA-ships with many of these people, including Ruth Etzioni and Caroline Rotter at Fred Hutch, a lot of students at the Office of Health Economics in UK, and many others. Next slide. Typically, our PhD program is in health economics and outcomes research. And historically, our graduating students have been placed in 1/3 in academia, 1/3 in industry, and 1/3 about in research organizations. Here are some of the names of the recent graduates and where they have ended up after graduating from our program. I'm going to highlight a few alumni that have recently graduated and where they have ended up. Next slide. Here are our current PhD students. The one thing you could see is we try our best to kind of develop and accept a diverse group of students from various backgrounds and from various training backgrounds and also personal backgrounds. And we have a very well-knit social culture within the institute with strong connections between faculty and students. Slide. Here are some of our recent graduates. Jacinda Fulcher, as she just graduated, her dissertation was Understanding HIV Pre-Exposure Prophylaxis Used in the United States and the Potential Impact of Community Pharmacy. She's now a research scientist at the Bill and Melinda Gates Foundation and the Institute of Disease Modeling here in Seattle. One of our more recent graduate, Joyce Chiang, her dissertation was risk prediction and the value of polygenic risk score in colorectal cancer screening. She's in the job market right now. Another graduate, Sarah Kaur, she's been working on algorithmic discrimination and biases, and her dissertation was incorporating equity into healthcare decision-making around new technologies. And she's now a postdoc with Sherry Rose at the Stanford University. And then finally, Rachel Whitten, whose dissertation was equitable access and reimbursement for pharmacy-based services, a case study of adult vaccination. And she is now doing a postdoctoral scientist position in health economics for the World Health Organization at Lyon, France. One of the feature of our program that we do pay close attention to diversity, equity, and inclusion. We have a mission that we invoke every time we make any decisions for our institute to understand how we can improve these criteria within our institute, both in terms of the people we bring in, but also the way we interact with each other and try to make everybody get the best of what the institute and the program can offer. Here are our preliminary research competencies. Our program, long ago it was a pharmaceutical policy program which kind of evolved to become a more broader health economics and outcomes research program. And based on the work that our faculty and our students do. So our research emphasis has been in health economics, outcomes research, and policy evaluation. And we focus our attention both on developing theory and methods in each of these fields, but also a vast amount of application of these new theories and methods developed by us or elsewhere in novel applications of different projects throughout the spectrum. Next slide. Here is the choice research portfolio. Although one of the big topic that we work on in the institute is economic evaluation. But that just one part of our expertise and the research portfolio. As you can see, we kind of go from developing large chronic disease model, a lot of value of information, decision sciences projects, to all the way to behavioral health, community-based practices, infectious disease modeling, and policy evaluations and health economics, traditional health economics, incentive-based designs, and evaluation of markets too. One of the advantages students have in our program is access to cutting-edge data. We have the Meritive Market Scan, the Commercial Claims and Encounters database, which covers employer-sponsored insurance and Medicaid managed care programs. We recently partnered with Truveta, who has electronic medical record from 31 large healthcare systems in the United States. We do have access to Komodo Health Map data, which is also a much larger claims database. And more recently, the University of Washington in general has entered partnership with Cosmos, which is kind of the electronic medical record data for all EPIC organizations in the United States. And so we would have access to those. Right. We do publish the annual report every year. The latest one that came out last month, you could take a look at scanning the QR code or going to that website. And the annual report will really give you in-depth information about the spectrum of work that's being done on the institute and also the people that are behind that cutting edge work that you see. Next, I'm going to go into the Choice PhD program structure. You will get a PhD in health economics and outcomes research. And so I'm going to go to the different phases and different aspects of it. Next slide. So as you can guess, our PhD students prepare students to become independent scientists and leaders in health economics, outcomes research, policy evaluation. There is a special emphasis in pharmaceutical sector because you're in the School of Pharmacy. However, most or many of our students also work on issues that are not pharmaceutical related. Many have done nursing home related work. Others have done more kind of general kind of utilizations and healthcare costs. There's a current PhD student that is looking at gun violence. So the concept and the methods applied are broad, and the topics are broad, related to health and health economics. We currently have 19 PhD students across various years, and about 14 MS fellows spanning 2 years. Next slide. Here are the key emphasis or areas of study that our program encompasses, starting with biostatistics and epidemiology, health economics, decision sciences, clinical trial design, health policy, and data science. So I'm going to go through the overview of the program, which consists of kind of four different parts. The coursework consists of four different parts. Obviously, the core courses, the electives, but we have some seminar requirements and obviously independent research and dissertation. Next slide. Here is our core program. Students are required to take these classes throughout their program here or residence here with us. Usually, most of these core courses are completed in the first 2 years of the program. It includes courses like in epidemiology, in biostatistics, pharmaceutical policy analysis, pharmacoepidemiology, a series of economic evaluations and health economics courses with strong emphasis of asking students to take an applied microeconomics class in the policy school, and then a bunch of method courses both in the statistics and the biostatistics department here and other places throughout campus. Starting last year or a year before, we also developed this data science degree option, which PhD students can take. And this is a degree option, which if you complete it, you will get a specific mention of that you completed this degree option in your transcript. And this is a degree option in data science that where you take these specific courses from the computer science, biostatistics department, and one of our elective courses on machine learning. And the series of courses, once you complete it, you complete the criteria for getting the degree option. And it actually prepares you a lot on the cutting edge research that's going on in data science in HEOR in various aspects of this field. Okay. So the progression to doctoral degree follows here. So the first and the second year, the students are required to complete their core courses and take some electives. After completing them, they have the option to do the preliminary examination. Usually, we encourage them to do some in the first year and some in the second year. And by the end of the second year, after they have cleared their preliminary exam, we encourage students to think about potential dissertation topics and data sources available and explore different other data that we don't have, but may be available from other sources, depending on the topic that they choose. By the third year, they have kind of brainstormed certain dissertation ideas with their committee, with their mentors, and they establish a supervisory committee, and they go through different phases of the dissertation proposal that starts with a short proposal that continues to become a long proposal and a general exam, and you defend that proposal orally and by written means, and then you embark on the dissertation. And by fourth and fifth year time you complete your dissertation, you do a dissertation defense and become a doctor of health economics and outcomes. Right. Before we go into the application process, for which I'm going to turn to Marina, one of the things that I would say that we put a lot of emphasis in our program is mentorship. When students come in in their first year, they are always assigned advisor. Now, this faculty member may not end up to be your dissertation chair, going forward. But the role of advisor is to make sure that you are taking the right courses, progressing through the program in a right pace, and also help you with any other challenges or issues that you might face, transitioning your life to a new city or a new program. And during this time, we are also encourage students to go and talk to various other faculty members in the institute to understand what they do. We have a PhD seminar series where we present, the faculty and the students present their research so that newer students can understand what type of research is going on. And usually, it's a very collaborative and a social environment. By the third year, the students choose, after talking to various faculty, choose to decide what kind of dissertation they want to do and select the dissertation advisor and their committee members with the dissertation advisor to go forward and complete their dissertation. The dissertation advisor could be the advisor that was assigned to them, or they could choose some subject. I am going to talk maybe later, Marina, about the funding. Or we have a slide on the funding, right?
There's a slide about that.
Okay.
I'll cover it, yeah.
With that, I'm going to turn it over to Marina to talk about the application process, and I'm happy to answer questions at the end. Thank you.
Great, thank you, Anirban. So I'm going to switch gears and begin talking about the application process. So hopefully you are aware that our application deadline is December 15th. So all application materials should be received by this date. The only exception to that is sometimes, you're waiting for one additional letter of recommendation. If that is a case where, you're unsure if all your letters of recommendation will be in by the deadline, please reach out to me well in advance to notify me of those circumstances. We understand that that's not something that's always in the student's control, but please aim to have everything in by December 15th. Our admissions committee, which is comprised of several faculty members, and Julia, our student member, we divvy up the applications and review them by the first week of January, and then we'll send out interview notifications mid-January 2025. So our interview process is online, so that occurs late January, and then during the interviews you get the opportunity to speak with other current students and other faculty that are not on the admissions committee. And then we would provide offer notifications generally mid-February. And then we would ask those admitted to let us know their decision by April 15th. Between those two dates, we do an admitted student stay, which is a on-site visit to Seattle for those who have been offered admission, where you'll have the opportunity to see the campus, see our offices and facilities, and get to interact perhaps more informally with students and faculty. We usually have a social event as well, just to help students get a feel for our program and our culture and help inform their decision. However, I will say that if you are an international student, we can offer limited travel funds for you to fly out to Seattle. But usually we get most of those that are admitted on site for that admitted student stay. And then our program start date, we are on a quarter system, so it's a little later start than semester school. So our fall quarter usually begins the last week of September. So it would be a late September 2025 start date. In terms of prerequisites for our program, typical academic backgrounds where we see applicants applying would be students with master's degrees in fields such as epidemiology, economic statistics, or public health. Additionally, we'll receive applications from students with degrees in pharmacy, medicine, or other health-related fields, emphasizing those with strong quantitative skills. That is not an exhaustive list. We've seen applications from students from all sorts of academic backgrounds, and we welcome those to apply from diverse academic backgrounds. This is just typically kind of a snapshot of who applies to our program. As far as other admission prerequisites, the graduate school sets minimum admission requirements that all graduate programs at the University of Washington must adhere to for our applicants. So that includes having a minimum grade point average of a 3.0. That's on a 4-point scale. And for our program, we find that competitive applicants will typically have a GPA of a 3.5 or above. We do require the GRE, and that is required for all applicants. Lastly, if you are a non-native English speaker, you need to demonstrate English proficiency, and that's a graduate school requirement and a departmental requirement, and I'll speak to that here. I included this slide because I always get lots of questions, so I figured I would just address it here. So a main question I get is, I have a degree from a US school or a degree from the UK. Do I need to submit TOEFL scores? So I would encourage anyone who is a non-native English speaker to review graduate school policy 3.2 on English language proficiency closely, because there are actually multiple ways that you can fulfill this requirement beyond test scores. So I'm not going to read these, they're outlined here. Primarily those would be a degree from an English speaking institution. And there's different ways where you can meet that requirement, either through documentation from the school or if it's from a country on a pre-identified list, etc. And I will note that our English language test score minimums are a bit higher than the graduate schools. So for the TOEFL, IBT, or My Best test, we would require a minimum of a 100. For IELTS, the minimum of a 7.0. And for Duolingo, minimum of 130. So this slide is actually a snapshot of what our admissions rubric looks like. So we use a holistic admissions process. So each of these bullet points are one of the realms on our admissions rubric. Each are weighted equally. So we take just as much consideration for leadership experience as we would for work experience, for example. So I'll just go through these real quick. A strong record of academic achievement with emphasis on quantitative skills and critical thinking. Prior experience working in fields related or applicable to HEOR. And by work, it could be, full-time employment or an internship, and if you have that experience, be sure to highlight it on your CV or in your statement. We'd love to see that. Leadership experience, such as, conference attendance, being involved in student organizations on campus, as an example. Demonstrated interest in HEOR. Ability to communicate effectively, both verbally and in writing. And lastly, ability to contribute to the choice program learning environment. And here is kind of the different data points where we will could potentially inform how we evaluate you on these criteria. Okay, so this is just listed alphabetically, not order of importance, but these are all the kind of aspects of your application where we might glean some information on your aptitude for our program. Just a few application tips to highlight. can't emphasize this first one enough. Please contact your recommenders early. It's, let's see, the application deadline is almost 2 months away. I think if you're thinking about applying to our program, you should be contacting your recommenders now if you have not already, because they're usually pretty busy, and it's great to get those recommendations in on time. It's helpful to include a cheat sheet about yourself. So including maybe your CV, a link to the program, kind of just summarizing why you're interested in the program. That's always helpful for recommenders to see. Submit a strong, focused, and well-edited CV. Some aspects you could highlight on the CV include research skills, data analysis, and quantitative skills, any relevant internships or training experiences, electives, courses you've taken, or presentations you've given, as well as leadership experience. And throughout, please highlight any projects relevant to HEOR. And we love to see any publications that you've contributed to, even if not yet in press. And it's great if you can hyperlink those on your CV. That's always great for us to see. As far as how to apply, so you apply online through the UW Graduate School's website. So I'll just briefly go through these steps. It's all outlined in detail on our website. So you go to the grad school website application, select Start Graduate Application. You would select Graduate as application type. And the program is going to be Pharmacy-Health Economics and Outcomes Research, PhD. We also have a master's program, so make sure that you are selecting the PhD application. And then you would select fall 2025 as the quarter and year to which you are applying. This mailed application materials are not accepted. I haven't received anything in the mail in quite a long time from applicants, but this used to be more of an issue than it is now. But I'll just note, don't mail us anything. Additionally, you don't need to email us materials either. And if you have, updates you need to make to items you've submitted in your application, you can go into the application portal and update those items yourself. And the University of Washington does not require official transcripts during the application process. So you would only submit an official transcript, basically one that you pay money to have sent somewhere is an official transcript. That would only be required if you are offered admission, and then you submit usually just one transcript for your most recent degree to the graduate school to fulfill enrollment requirements. During the application process, you will be just scanning, uploading unofficial transcripts directly into the application. One question we get is, if you're applying by December 15th and then your fall semester grades come in on your transcript and you want to update the transcript, that's great. And we would love if you would do that. I think you can go into the application portal and just replace the file. I would encourage you to do that so we can see what your most recent grades are if you're currently enrolled in a master's program, for example. Lastly, late applications will not be accepted. The application shuts down at midnight on, I guess, December 16th. So apply by 11:59 p.m. Pacific time on December 15th, 2024. So the application fee for all graduate programs at UW is $90. The grad school administers fee waivers. So those are based on the Washington State Need Grant Program eligibility criteria. If you would be requesting a fee waiver, you should submit that request at least 7 days prior to the deadline. And unfortunately, our international students that would be requiring an F1 or J1 visa are not eligible for application fee waivers. I wish they were, but there's nothing we can really do about that. So that wanted to make you aware of. I do get questions about that. And we'll share these slides out. The link to learn more about application fee waivers is in the last bullet there. Okay, so this is just a slide about some frequently asked questions, kind of leading in to our Q&A section. I think Anirban was going to speak to funding a little bit. Anirban, did you want to take this bullet point?
Sure. Sure. Let me first also answer the common questions that's coming up in the chat, which is we take about 3 to 4 and admit 3 to 4 students to our PhD program every year. Predominantly, if not everybody, comes here with a master's degree. I don't remember the last time we admitted anybody with just a bachelor's degree. We have admitted students with a PharmD degree before that have shown enough research experience that kind of bodes well for that student to perform on a highly quantitative and research program such as ours. But majority of our students comes to us with a master's degree, and they finish or graduate in the master's degree before they join us. In terms of funding, all of our students graduate with full funding throughout the tenure that they have with us. However, we only guarantee about first 2 years of funding. And then from the third year, the responsibility of finding funding shifts to the student, because at that point, the student is also deciding what kind of research they're doing, what kind of work they want to do, who they want to work with. We have quite a few research assistant and teaching assistant positions available, not just with us, but across the university, in other institutions, the Gates Foundations and PATH, and students, and we bring many of those opportunities in front of our students as they come to us, and the students get to decide the type of work they want to do, or the type of scholarship they want to pick up, and then go from there. And to date, all of our students have been fully funded till they graduate. The TA-ships and the RS-ships appointments are basically 50% FTE as a part of the fellowship over the first 2 years, and even the graduate staff assistantship, which I think Marina can talk about, as a 50% FTE. Stipend is currently $3,125 per month at the intermediate level, and plus obviously the benefits, includes health insurance, and it is possible that some students take on multiple projects. So they have a primary RS-ship, but they also take on some hourly pay and other stuff along with it, as needed in their program. The waiver of required courses, I think Marina, you should take this on.
Sure. This question comes up in particular, like say you are you have a master's in public health in epidemiology or biostatistics. Some of our core classes are biostatistics and epidemiology. So we do get requests sometimes to waive portions of those required core series. Those are, I mentioned those two because those are the ones that we usually get asked about. And it is possible. We have a process for that. It involves filling out a course waiver request form and submitting to the graduate program the syllabi from the courses you are requesting to be waived, as well as this current syllabus for the UW course. And then we would review that and determine if it's something that could be waived. So that would be something that comes up once a student is admitted and kind of preparing for that first year of courses. We do often find that many students will end up taking the UW version of those courses anyways, and they find it to be useful. But that is an option that we have a process for. And this next bullet point, Anirban spoke to this a bit, kind of the general breakdown of where our students are heading in their career trajectory after graduation: third academia, third industry, a third government, or nonprofit organizations. Next, we are a STEM designated program. So if you are an international student, please be aware of that. Our program is eligible for the STEM OPT extension. And lastly, just emphasizing here again, the GRE cannot be waived and scores need to be valid, so no more than 5 years old. Okay, so that is the end of our prepared slides. I've seen lots of little red flags here from the Q&A box.
Yeah, there is one question whether they require credential evaluation for degrees earned outside the US. I know we need this for faculty application, but I was not sure for student application.
Yeah, so we get asked about that a lot. It's not something that we require, nor does the grad school require. However, if you have one already, it can be helpful to just upload that with your transcript. So the faculty who may not be familiar with the educational system of where your degree was received can see that. So I wouldn't necessarily go out of your way to pay for one. I know they can be a bit pricey, but if you have one, feel free to upload it. Okay. See, Julia has been answering a lot of these questions, and Jing, so that's great.
Yeah. So yeah, it has been a question. So one of the thing about international students is that the first 2 years of funding we guarantee for anybody, whether international or not. After that, some RShip may be restricted, may have restrictions for citizens only, but there are other ships that do not make those restrictions. All our TA ships do not make a restriction whether you're international or not. Usually end up you get the equal opportunity to apply for it, all of them. Let's see.
Oh yeah, someone asked if we have a minimum GRE score for this program. Jing answered that. Thank you. Correct, there's no minimum GRE score required, but if you have a solid score on the quantitative areas, that's certainly where we would be looking to gain some information about you as an applicant.
And the GRE score needs to be submitted officially, right, through ETS, right, Marina?
Yeah, you can submit them. You have to self-report them on your application kind of unofficially in order to submit it. But after that, if you can go to log into your ETS portal and have those sent to us, that would be great. Okay, if anyone wants to raise their hand, I can let you speak, unmute you if you wanted to ask any questions during this section. Okay, and oh, great. Okay, Andrea, you should be unmuted.
Hi, can you hear me?
Yes, I
Yes.
can. You can.
Yeah, hi. Thanks for the information session. And I have a couple of questions. So I'm currently an econ student. I got my bachelor's degrees and also master's degrees in the econ department. I wonder, could you please give some like advice on the statement writing? And I also wonder, how do you like evaluate the publications during your application process? Yeah.
Um, I'll after I finish, I'll turn it to Julia, who also came into the program with similar background. But we do like to see publications in your CV. Part of the reason is that this is, when you're doing a PhD, you are entering a research intensive field. So we want to see that you have some passion for research, or at least have some experience doing research, even if it's in a multi-collaborative environment, or even you're doing it yourself. So any publications is great. Obviously, we would love to see publications in the HEOR field, so at least you're exposed to healthcare. There are a lot of people, a lot of times we see strong mathematicians apply in our program who have absolutely never worked in health, and that kind of we give less weight to such applications, because I think um, we feel that you need to come in with some exposure to healthcare and the healthcare field to get running once you join our program, because there are a lot more to learn and kind of adapt and adopt in this field. Julia, you may mention about your background in applying with economics degree.
Yeah, absolutely. So I came in with a master's in economics. I had no publications, so that is definitely not a requirement. Some of the people in my cohort did, but I didn't. So if you don't have any publications, don't feel like you shouldn't apply. You absolutely should. I also had a lot of non-research work experience, which did not deter me as a student. And again, they accepted me, so I made it through. I worked in healthcare with people with dementia. I worked in marketing research. And so you can be a student from a pretty non-academic background and still get in and be a successful student.
And
Thank
then
you.
there, I think the background in healthcare and exposure, actually working experience in healthcare really mattered. And the courses that Julia took, and how she performed in those courses, all of those was taken into account.
Got this. Dr. Basu, I also have a question. You mentioned that the working experience on to healthcare matters. So the working experience is like a research experience or a full-time job.
It could be either. It could be
Okay.
either. I mean, sometimes people work in the government, in the healthcare field. They're not doing research, but they actually are engaged in understanding the nuts and bolts of policy making. And that's quite valuable, and so that matters too.
Got this. Thank you. That's all my
Okay.
questions.
Thanks,
So,
Andrea. Sanaya?
hi, yeah, sorry, I wanted
Oh,
to
yeah.
answer Gabriel's question. They mentioned that whether an applicant without a master's degree but with a bachelor of pharmacy degree, extensive research experience be considered as just PharmD. So as Annabelle was saying earlier, most of I think almost everyone who got accepted has a master's. And then we have accepted people in the past who hasn't PharmD. We do get applicants with just bachelor's degree and without postgraduate degrees. So in that case, then you just have to really stand out in terms of your research experience and your quantitative skills for you to be competitive. We don't have a strict requirements that says that if you only have a bachelor's degree, you can't apply. It's just that in that case, then you just have to demonstrate your promise and potential in other ways, and the bar would probably be higher in that regard. If that makes sense.
Thanks. Yeah, thanks. All right, we have another hand, Sanaya.
Hello, everyone. Can you hear me?
Yes, we can.
All right. Thank you so much for the information. I had a question about the data sources that were mentioned, I saw that there were a lot of very exhaustive data sources available. However, have there been instances in the past where students needed to access a clinical population and conduct primary data collection? Is that an option, or is that not typical for the program?
People have in the past, PhD students embarked on dissertation projects that required data collection. We kind of, to some extent, discourage it just because the data collection can sometimes be unpredictable in terms of the time and the resources that are required to do so, which would basically extend your PhD time and the number of quarters you'd be paying tuition to do your dissertation and graduate. But it's not a no-no because in the past, some students have done it. For example, one of my students did an entire DCE experiment, the discrete choice experiment in Uganda, and collected formal data through that. Some other students have incorporated some mixed methods into their dissertation project. But usually it's a case by case basis, but you have to balance the need for that data versus the time and resources during your dissertation would take to pull that off.
Agreed. I had another question. May I ask it, or are there others who would?
No, go ahead.
So the next question was about, I know that the PhD program, you are awarded a degree in health economics and outcomes research, and I'm wondering if, there are specific tracks within the program. Like, I know that there are different focus areas, but I'm wondering if it's really a matter of just structuring your coursework towards a specific track. Like, for instance, if someone's interested in pharmacoepidemiology, then they would take
Right.
more coursework in that area.
Well, that's a good question. We are a small program. As I said, we take 3 or 4 students a year, so we don't really do tracks. I think the core courses are courses that everybody takes. We have sufficient leeway about how you design your electives, and so suddenly, and people have focused, have graduated with a more pharmacoepi kind of concentration and expertise than our more health econ expertise. And it really depends on the type of work that do. Like, it's your dissertation and your research publication would speak a lot about what you do versus the degree you're getting, or the track that you're in.
All right. Thank you so much.
Any other questions? Let me see. There are a couple of remaining questions.
Yeah.
Acceptable.
Anirban,
Okay.
could you please maybe go a little more into depth about GRE scores? Some people have brought up the questions of asking maybe average scores of those who have been accepted, trying to gauge whether or not their scores would be competitive. I know there is no minimum requirement, but I think people are looking for a little more guidance.
The main guidance I can give is that we do put more weight on the quantitative score than the other score, the verbal and score. And part of the reason that we want to look at because this program is highly quantitative, and we want to see if we want to see if not only in courses but in analytical thinking and in performance metrics, in a standardized setting, people have excelled in the quant. But again, things happen. You can get the middle of the range GRE score, but excel in some of the quant score, or have published a very quantitative paper already, and then the GRE score gets, not that much important. So I think it's Marina said, we took a holistic approach and look at all facets and kind of try to get an overall picture about not only like what we would get, but whether you would thrive in our program or not.
Let's see, there's a question in the chat, maybe Jinga Anirban, you can answer. Oh, where to go? So what are some key technical skills that you could highlight in your application, or the exact question is, what are top 4 to 5 technical skills that can strengthen my profile?
Yeah. As I said, exposure to the healthcare field, exposure to research, exposure to some form of programming and data. I think the type of courses you have taken, obviously, we want to see people coming up with a master's in the healthcare related field, with some quant courses in there. I think all of those things matter. The other thing that comes out with the statement of purpose that we would also like to see a passion for the work that you do, passion for this field, why you want to do a PhD. I think often we miss seeing or do not find a rationale from the students why they do a PhD in health economics and outcomes research, and not a PhD in epi or not a PhD in econ or something else. Right? Why this field? And articulating why you want to do a PhD in HEOR is a strong suit, I think, that you can give us.
I'm going to ask a question. What do you think sets our program apart from some of our peer institutions?
Yeah, well, at this point, you would have, there are a few high quality PhD programs, at least in the US, in HEOR. And, honestly, you can't go wrong, if you get admitted to any of the programs. They're very high quality programs. I think our program is characterized by not only a very strong course requirement and the quality of the courses, like our biostats and stats rank on the top in the world. We have a strong connections with many other departments, but I think Seattle is a unique environment. I've been in Chicago and other places for a long time. It's a unique environment because not only we have University of Washington, but we have lots of other organizations in Seattle, like the Gates Foundation, the Fred Hutch Cancer Center, the VA HSRND, the Seattle's Children, and the walls are very low. So we collaboratively work together. Many of our students get opportunities in many places like that, the Kaiser Foundation, and all of those. So that's one. We also have a very close-knit group among students and also among faculty and students. And I think our student to faculty ratio is quite strong. We have a lot of one-to-one mentoring going forward. So I think all of that generates a very enjoyable but also rigorous PhD program. And we are also highly connected with our alumni network. The alumni are engaged. Many of us are affiliate faculty. And they also kind of talk to our students, mentor our students even after they graduate. So that connection is also there.
So if I may just add to what Anirban already mentioned, I really want to emphasize the strengths of mentoring in our program in relation to other top programs. So I've stayed at a few different institutions, stayed at UC Berkeley, Cornell, and now at UW. I can say I've never had experience with any other graduate programs with such a strong focus on mentoring, both peer-to-peer mentoring and also relationship between professors and students. So we have social events, almost weekly, and then there are a lot of opportunities to interact with peers and with professors. And all the professors genuinely care about students' their well-being and interests, and all the sort of the proposals are reviewed by all faculty before the student can advance their dissertation phase. So there's a lot of structure building to make sure that students can succeed. I would say that really sets our program apart from other programs.
Great, thank you. With that, we are actually at time. So we'd like to thank you for joining us today. This session, it was recorded. We'll post it to our website and send out the link as well as the slides to all those who registered.
Yeah, there's a last question that came in, and I'll answer that. How the role of AI and ML projects. As I said, we have lots of focus on using ML and AI in many aspects of HEOR projects. Our students can take the degree option in data science that includes courses in computer science and biostats, and have that option recognized in their transcript if they complete that series of courses. We have graduate courses in AI and ML in HEOR, and given the vast amount of data that we have access to, and some of the advanced ML method options that we have on campus, and AI, so there's a lot of opportunities. Many of our faculty, actually work in the AI and HEOR space, including myself, that doing work on algorithmic discrimination and bias. So a lot of scope around that. Cool.
Okay, thank you very much. That concludes this session, and feel free to reach out if you have any questions, and we look forward to receiving your applications. Thank you.
Good luck with your applications, and hopefully we'll get to see you soon. Bye.
Thank you. Bye-bye.